Namaste, all the viewers and friends, our subscribers who have been watching our videos, who have given us very good response for the videos that we're making. It is an encouragement for us to continue making these videos. And like I said, like we've been telling, our intention is creating awareness of how natural healing solutions can help maintain health, improve health and well-being, and manage a lot of diseased conditions. So with the same intention in mind, today we've come up with another new topic for discussion, which is Chondromalacia Patella. I know it is very not so easy to pronounce and understand, but let me break the word for you, and it is easy to understand that way. Chondromalacia is basically a sick cartilage. Chondro is a cartilage. Cartilage is like, we have door hinges that support the joint and connect the bone. Cartilage also function in the same manner in our body. They help joint, the formation of joints, maintenance of the movement, ease of the movement, supporting the joint structure, which is mainly the bone. So cartilage is something that works like a hinge, door hinge in our body. So a sick cartilage is chondromalacia, and it is happening, the cartilage is behind the patellar bone, which is the kneecap. So patella is the kneecap. So that cartilage which is behind the kneecap is sick. That is why it is Chondromalacia Patella. What do you mean by sick cartilage? Because of various reasons, I will come to what causes chondromalacia. Because of various reasons, if the cartilage behind the kneecap is breaking, has become very soft, is getting eroded because of wear and tear, that can create a lot of disturbance within the joint. And whenever there is a disturbance in the joint, the main symptom is pain, right? So that cartilage that is behind the kneecap, when it starts eroding or becoming soft, it tends to not support the joint properly. So there is a feeling of grinding sensation within the knee. So it is also very commonly called as grinding knee problem, Chondromalacia Patella. So when somebody feels grinding sensation or pain is when I am climbing steps, or when I'm climbing down, when I'm walking on an irregular surface, when I'm trying to put a little effort on the knee and sit down, when I'm trying to walk for a lot of distance, that's when the support of the knee starts reducing and pain, stiffness, some sort of weak feeling within the knee arises. So symptoms, like I said, are pain, the grinding sensation when the joint is either flexed or extended, and sense of weakness of the joint on a long term basis. If somebody is not gotten treated for chondromalacia, it can make the knee feel weak. Okay, and it can come in any age group. So it is not necessarily that only in aged people we see Chondromalacia Patella. Any age group people can get affected with chondromalacia. So what are the causes? What can cause sick cartilage? The reason number one is injury. Most of the times these injuries are not noticed. When we ask patients, did you have any trauma, any injury, they will immediately say no, nothing was there. But when we dig deep, there could be a fall or a hit on the knee, or a sudden jerk or pressure on the knee joint, which they might not have noticed, but that would have affected the cartilage, impacted the cartilage in a big way, and slowly it can start becoming soft and weak. So major cause is injury and overuse of the joint and unhealthy use of the joint. So people who are into sports, if they are they are always using knee joints, they are overusing the knee joint, and they're not allowing it to relax properly, not taking care of the joint nourishment, joint relaxation, joint rest, then that can lead to Chondromalacia patella, because this over and over pressure and impact on the cartilage. So injury, over and unhealthy use of the joint, and of course anything that causes wear and tear. So even degeneration, even aging can causes wear and tear of the cartilage, and that can also soften the cartilage and result in Chondromalacia patella. So these are some of the main causes of Chondromalacia patella. Basically what happens with injury or trauma, jerky movement and overuse is there's a inflammatory process that's happening within the cartilage and the joint, and that results in burning sensation, pain and stiffness, and swelling at times and all of these. So how can we manage Chondromalacia? Is first recognize what is happening, recognize the symptoms, and approach the doctor for treatment. Many a times application of certain painkiller ointments and certain topical medications help. Internal medications, NSAIDs help. Rest helps. Eyes application on the joint will help. Supporting the joint well with a kneecap also helps. These are something that you can start with to see whether there is some improvement in the symptoms. And many people do not want to go for painkillers. Many people do not want to use any chemical external aid to bring down the inflammation. So there and places where issues where these home remedies have not helped, that's when you can try therapies. And one of the most promising therapy we've had is acupuncture. We have seen very good response through acupuncture in Chondromalacia patella. When somebody comes with these symptoms, we examine and then select points that will help improve the nourishment within the joint. So it is a cartilage within the joint, right? There is a kneecap, and below the kneecap there is this cartilage. So we will not be able to directly access the cartilage. So we make sure that we give points around and to the joint in such a way that it strengthens the overall joint, improves the nourishment of the joint, and brings down inflammation parallelly. Like I said, with wear and tear there is inflammation, and that inflammation gradually comes down with acupuncture. So acupuncture along with sun exposure, along with knee strengthening exercises, which are very, very important to strengthen the joint complex, is very, very helpful in managing Chondromalacia patella. So recognize, use home remedies that like ice application, rest and support. If it is not helping, then we can slowly shift to therapies. Acupuncture therapy is going to help. Isometric knee exercises specifically are going to help manage Chondromalacia patella. Sun exposure is also another thing that strengthens the joint. All of these put together can give very good results in Chondromalacia. Of course, knee is always a joint that takes a lot of load. So if somebody is overweight, that's a risk factor and a causative factor. So weight reduction definitely complements these therapies and home remedies that you do. So weight reduction, nourishment, all of these are parallelly very, very important. So with that, I am sure I've given you enough information on what is Chondromalacia patella, how can we recognize the symptoms, and how can we manage this condition. Okay, so thank you for your patient hearing. That's it. Thank you then.